All right, my name is Chantell Hammond, and I will be presenting on the signs and symptoms, as well as the transmission of Bordetella pertussis. All right. So when discussing the signs and symptoms of Bordetella pertussis, it's important to know the difference between the two. A sign is any objective evidence of a disease as noted by an observer. A good way to distinguish a sign from a symptom is by asking, can this be seen? Signs of Bordetella pertussis include an initial minor cough, minor fever, severe coughing fits, usually violent and rapid continual coughing, followed by a whooping gasp for air, beginning 1 to 2 weeks after the initial cough, apnea in infants, and coughing-induced vomiting. Keep in mind that all these signs can be observed by someone other than the patient. A symptom is the subjective evidence of a disease as sensed by the patient. A good way to distinguish a symptom is by asking, can this be seen or only felt? Being that symptoms are what the patient alone can experience, these are usually used in addition as additional information during the diagnosis process on top of the observable signs. Some of the most common symptoms of Bordetella pertussis include nasal congestion, exhaustion, and malaise. In general, signs are more precise than symptoms, though both can have the same underlying cause. This chart illustrates the stages of progression displayed by pertussis. As you can see, it has an incubation period of about 5 to 10 days, which is the time from the exposure to the onset of symptoms. The onset of symptoms marks the beginning of the communicable period, which can last for roughly 3 weeks. The communicable period is divided into 2 stages. The catarrhal stage, which is the first 2 weeks after the appearance of signs and symptoms, during which the signs and symptoms are minor, like a minor cough. The last half of the communicable period is the proximal stage, which is displayed by an increase of intensity of signs and symptoms. This stage can last anywhere from 1 to 6 weeks. The final stage of this disease is the convalescent stage. This stage is the gradual lessening of signs and symptoms, and it can last as little as a few weeks or as long as months. This video clip will give you a better idea of what Bordetella pertussis sounds like. Note the whooping gasps for air between coughing fits. This would be displayed during the proximal stage. Now let's talk about transmission. Transmission of Bordetella pertussis, or whooping cough, is highly contagious and is spread among people by direct contact with fluids from the nose or mouth of infected people. It is only spread from person to person. This can be done in any number of ways, from sharing a drink to inhaling the small bacteria-containing droplets propelled into the air by a cough or sneeze. People who could contaminate their hands with respiratory secretions from an infected person and then touch their own nose or mouth. Due to the intimate nature of the transmission of Bordetella pertussis, it is fairly common for infants to be infected by a parent, sibling, or caregiver who might be unaware they have the disease.